Hello, I'm Gina Jordan, and today I'll be talking with you about sleep disorders. Sleep disorders disrupt or exaggerate the natural sleep cycle of an individual. These disruptions can come from many different sources and have serious health implications. Psychologists and other scientists who study the causes of sleep disorders have found that these problems can be a result, either directly or indirectly, of abnormalities in one or more of the following systems: the brain and nervous system, the cardiovascular system, metabolic functioning, and the immune system. There are many ways that these systems can be disruptive and lead to poor sleep. Typically, they fall under one of four categories. They are physical, environmental, medical, or psychiatric. According to Sawyer and Weaver, our environment and physical beings can contribute to our sleep quality. Failing to observe good sleep hygiene can lead to poor sleep, as well as physical ailments. Unhealthy conditions, disorders, and diseases can also cause sleep problems. These include hypertension, apnea, asthma, obesity, and even some medications. Psychiatric considerations include emotional disorders like stress, anxiety, depression, and bipolar disorder. It's now been shown that genetics, medications, and aging can all play a part in an individual's ability to sleep normally. Researchers have found that narcolepsy has a genetic root, and about half of all adults over the age of 65 have some sort of sleep disorder. Another factor that weighs heavily on sleep is individual schedules. Whether due to profession or home life, many people live on a schedule that requires them to be nocturnal, which is contradictory to their body's normal sleep patterns. Some of the people who fall into this category are physicians, truck drivers, shift workers, parents, and teenagers. According to the National Institute of Health, the amount of sleep a person needs will vary depending on their life stage. This chart shows their recommendations for healthy amounts of sleep. In order to help maintain normal sleep cycles, the Center for Disease Control recommends proper sleep hygiene. This means optimizing your sleep habits and environments for proper sleep and allowing adequate time for sleeping. Here are some tips. Go to bed at the same time each night and rise at the same time each morning. Sleep in a quiet, dark, and relaxing environment. Adjust the temperature for your comfort. Make your bed comfortable. Use the bed only for sleeping. Remove all TVs and computers. Dysomnias involve incorrect sleep cycles. Daytime drowsiness, inability to sleep, and inability to maintain wakefulness fall into this category. These do not only cause poor sleep, they can also be a symptom of poor sleep. Respiratory issues are often discovered during sleep studies when individuals are unable to understand why they are continually startled awake or do not feel rested during waking hours. Sleep apnea is the most serious of these. However, snoring, restless leg syndrome, and periodic limb movement fall in this category as well. Parasomnias involve unnatural sleep behaviors or actions and can cause sleep disorders. Some of these are bedwetting, tooth grinding, groaning, sleep terrors, sleepwalking, and sleep talking. Short-term or acute insomnia can be caused by life stresses, illness, or environmental factors such as light, noise, or extreme temperatures. Long-term or chronic insomnia, which typically lasts at least 3 nights a week for a month or longer, can be caused by factors such as depression, chronic stress, and pain or discomfort at night. Treatment starts with careful diagnosis, as there are many disorders that have overlapping symptoms. Once diagnosed, the treatment seen here can be used in combination or alone, depending on the individual needs of the patient. Recreational drugs, alcohol, late nights have become the norm. Electronics have invaded our sleeping areas, and many cannot sleep without the help of medication. These, aside from the factors that are beyond our control, have led to sleepless nights, which lead to health problems that increase our sleepless nights. Sleep disorders have become reality for much of today's society, and the reason for this appears simple. We work harder, we play harder, and we seldom consider the risks to our health. My suggestion: sleep on it.